Thank you so much, Mr. Chair, Madam Vice Chair, members of the BEST Committee in the House and Senate. For the record, I am Delegate Michelle Guyton, District 42B, Baltimore County, and I am thrilled to be able to present you something today that I don't think this committee has heard before. And no, it doesn't have anything to do with disabilities. It does have something to do with veterinarians. And I think I still have, do I have more panel members? Virtually, I apologize. I respectfully request a favorable report on House Bill 1097. What this bill does is it clarifies the duties of a registered veterinary technician in Maryland code. It's sort of the Wild West in that area right now in state law. Our state faces very serious shortages in the veterinary field. You all have heard this, not just this year, but a lot last year. And the technicians, who are very well trained, if they are registered with the state, are underutilized, and their advanced training is disincentivized due to a lack of clarity of their duties and consistency about what they can do in the office. There are very few regulations currently on veterinary technicians in Maryland law, and so we sought to fix that problem. And we did that because we went and visited a lot of veterinarians. And I know a lot of you know that my own puppy, who has been the subcommittee chair mascot this year, has been sick a lot. And spending time with those folks, we kept asking them, what do you need to help? How can we help you do your job better for the pets that you serve and the families that love them? And one of the biggest things that they came back to us with was this: we need an expansion of, or a clarification about the duties that these vet techs can actually perform in the office, because nobody really knew what the laws were there. So this bill codifies the duties that non-registered and registered veterinary technicians can perform in Maryland. And just so that you know, because this is new to us, a non-registered veterinarian tech really can walk in out of high school at 16 and start working and do various things in the office. They don't require any certain formal education on these issues, right? A registered veterinary technician is a totally different thing altogether. And in many states and different programs, they're actually calling themselves veterinary nurses. And there is a push to kind of change that nationally, so that the professionalism of that is actually recognized. In Maryland, however, right now, we still call them veterinary technicians. So the framework we used is based on recommendations and model legislation that came from the American Veterinary Medical Association in partnership with the Association of Veterinary State Boards. And I have a copy of that if anyone cares to read it. It is quite long. House Bill 1097 also defines levels of veterinary supervision, which Maryland had not included currently in any sort of law, and enables the State Board of Veterinary Medical Examiners, which is why Deputy Secretary Jones is up here with me today, to define levels, to develop an alternative certification path for experienced veterinary technicians who choose to become registered. So this bill does not, this is important based on what you may hear from, I don't think I actually have any real unfavorables anymore, which is wonderful. But this is very important that you hear this does not expand the scope of practice for veterinary technicians beyond what is codified in the surrounding states. And I will say that our bill is actually much more conservative than, say, Delaware. After hearing the testimony last year in this committee, there was no way I was going to push, for instance, for rabies shots, which is something that they can do elsewhere, but that is not in the bill. It puts us in line with a bill that's passing in Pennsylvania right now and with what West Virginia is already doing, but it is actually very, very conservative compared to the states surrounding us. It also does not allow them to develop an independent relationship with their clients. So you can't hang up a shingle that says, I'm a registered vet tech, and see animal patients, right? That's not part of this. The veterinarian in charge, the supervising veterinarian, has to be still the supervising veterinarian at all times. And it is up to that veterinarian's discretion how many, or if any, of these duties in the law that they will allow their registered veterinary technician to do. So there are 3 levels defined nationally, and sort of levels of veterinary technical utilization from the Animal Hospital Association, and we only use the most basic level. So the things that we know they are trained to do in programs at the simplest level in this bill. There are 2 other levels that we chose not to go there because of pushback. I've worked with the Maryland Veterinary Medical Association for many months on this and several other pieces of legislation of interest to them. I appreciate their continued engagement, their willingness to make this work. We disagree on just a few provisions, and we went from probably 50 to like 2 that we disagree on. So I think that's a win. We probably want to agree on everything. And then I also have to point out that because of the letter from the Department of Ag, I had to go back in and look at this bill carefully and was up all night doing so. And I really, really appreciate that they helped us recognize that there were some drafting errors in this book on this bill based on some amendments that we had already put in. So we have, I believe, solved all of the problems that they listed in there, what was initially a letter of concern and is now only a letter of information, right? And we have also worked with the other favorable with amendments that you have in front of you to pretty much give them everything that they want. So with that, I hope that you will help me move 1097, enabling veterinarians to better utilize well-trained individuals. It supports our state economy by keeping better paying jobs here rather than having them go to other states where they can do more exciting things and be paid more. And it also helps our animals and the families who love them. So thank you very much.
Deputy Secretary, before you begin, I just want to know, you're not signed up to testify. I'm going to let you testify, but please try to sign up so we know who's testifying today.
Who is that? I'm sorry, to whom are you speaking?
Well, Delegate, and you're signed up, but Rachel.
So
yes.
So go ahead. I'm just reminding you, please sign up.
Sure.
In the future.
That wasn't an error that we just, I'm only here because she asked, due to the fact that there was initially a letter of concern.
Okay.
Just for the record to say, this is now a letter of information based on the amendments that were submitted this morning. Initially, the State Board of Veterinary Medical Examiners was opposed to the bill, and we had submitted a written letter, just written, of concern. And as of this morning, that changed. And so in case there were questions, that's the only reason I'm here. But
great. Thanks for working it out. We'll call our virtual witnesses. Ashley Nichols, DVM. Please go ahead.
Let's see. Hello, I am Ashley Nichols, a practicing veterinarian in the state, as well as president of the Maryland Veterinary Medical Association. And I am happy to represent the MDVMA because we are very excited about this bill and codifying key responsibilities within veterinary facilities across Maryland. This legislation is empowering registered veterinary technicians working to maintain their job security and responsibilities. However, there were a few concerns around current language of this bill, which prevented our full support. As such, we're asking for the following amendments and are in favor of HB 1097. First amendment is what both veterinarians and technicians wanted. Page 6, line 15 through 17 did not define non-invasive, and I hear that's been changed now. So the other issue was lines 20 through 24 on page 7, which would allow technicians to essentially practice unsupervised, which also sounds like it's been changed. So the one thing we would like is to have immediate supervision heading under assistance, which would allow dental prophylaxis, anesthesia monitoring, and surgery setup. Even with increasing numbers of registered technicians in the state, there's multiple facilities that don't have a registered technician. Immediate supervision grants a veterinarian the flexibility to continue to utilize their skilled assistance while ensuring they can implement life-saving intervention immediately. And one of the other things we request is that it is vital that phlebotomy be assigned to assistants, because currently most facilities assign assistants and technicians to this, but stating that only technicians could do it implies that it would be only technicians and things like that. So I want to thank Delegate Guyton for all of her efforts on this bill, and we continuing to work with us. So we greatly appreciate this and all of the discussions that we have been having over the last 24 hours. So thank you so much.
Thank you. Dr. Weeman, please go ahead.
Thank you. Yes, on behalf of the Maryland Veterinary Medical Association, I Dr. Weeman, and I'm here to submit testimony that is favorable with amendments on HB 1097. We really do appreciate the sponsor of this bill and thank her for the work that she is doing that we think really is important to clarify the support roles of individuals within veterinary hospitals across the state. We request a separate category of immediate supervision as one of the amendments to the bill. We'd like that to be created for veterinary assistants when performing dental prophylaxis, monitoring anesthesia, and when setting up for surgical procedures, which includes machines, delivering anesthetic medications, respirators, and monitors. The difference between life and death during anesthesia can really mean seconds, and it's critical that a licensed professional be providing immediate oversight during these times. And please refer to our written testimony for a more comprehensive reasoning on that. I do appreciate that page 6, lines 15 through 17 have been addressed. We don't want to allow an assistant to perform any non-invasive procedure, particularly if non-invasive is specifically defined. And while we trust the majority of veterinary professionals will delegate responsibly, it's critical to ensure only licensed individuals are allowed to perform certain procedures. Furthermore, on lines 20 through 24 of page 7, allowing technicians to function with indirect supervision, we think that inherently, while we're certain is not the intent, might open the state up to the potential for minute clinic type practices, essentially operating without a licensed veterinarian. We obviously know and trust that Delegate Guyton does not intend that. And so we look forward to working to just make sure we can finalize that language with SBVME, State Board of Veterinary Medical Examiners, help as well. Finally, we'd like to see phlebotomy listed as a task for veterinary assistants. We understand it seems like semantics, but veterinarians are a law-abiding profession, and we think it's going to create a little bit of consternation among practitioners in the state if the tasks of the veterinary assistant aren't delineated. Thank you for your time and consideration of our request to build on the foundation of this already great bill and make it something we believe all veterinary professionals will enthusiastically support.
Thank you, Delegate Allen.
Thank you, Mr. Chair. Delegate, I just want to thank you for bringing this bill, first of all. You know, especially I was reading some of the favorable testimony, especially colleagues, if you haven't read the letter from Mr. Alfano about you know, the utility that this bill will provide. It's an incredible letter. And I know, you know, when we're talking about the patients here, we're talking about family members as well, as he said. So I really appreciate that. I did note on his letter, he did talk about the timeline for the bill of being October 2027. I know there's been a lot of amendments, still amendments coming. I just want to make sure that timeline is still in place because that seems to be rather key.
Actually, thank you for asking that question. He actually, I believe, was referring to a timeline that we had put into the bill to sort of grandfather and allow an experienced veterinary, what would actually be a veterinary assistant, to go through an alternative pathway to become a registered veterinary technician within that 3-year period. So that's the date that he's referring to there. He talked about the amount of time that it goes through. It is not the effective date of the bill, however.
Okay.
So I think that could be a little misunderstanding. The effective date of the bill is October of this year.
Thank you for
So,
clarifying.
and I thank you very much for that question.
Delegate Ruth.
Thank you, Mr. Chair. So you might have said this, and if you did, I apologize. Can you explain a little bit about what some of the duties of a veterinary technician are? And if they have to work under supervision of a veterinarian, how does that expand the capability, relieve the pressures on the shortage?
Yeah, absolutely. And I appreciate that call, that question very much. I think that the letter that Delegate Allen referred to does reference that really well. It's a letter from our Baltimore County Pet ER that is in Cockeysville. And he talks about a day in the life of an emergency hospital where actually you have to make the decision sometimes between a pet who needs life-saving surgery that the veterinarian has to be right there and actually performing the surgery, and another pet that may come in and may need another type of treatment, but that currently it is not clear whether or not a registered veterinary assistant can do those. And excuse me, I keep getting my phrase. Registered veterinary technician can do those, or a veterinarian assistant can do those. So what we're trying to do is clarify that for them. I think that he's telling us, and he told us that day, my own pup spent some time in that ER, that they have to make choices, really tough choices sometimes, because if a veterinarian has to be in the room doing some of these things that are less invasive and less complicated, then they can't be in the room with another animal who needs actual surgery. So that is the really important part. You can see in the bill that we have actually delineated 3 types of supervision that veterinarians would have to have. And again, this is all new to all of us, right? I don't think anyone's touched this statute like for many, many years. So veterinary assistants who basically can be trained in office or can come right off and work in the office from high school. They don't have to have any real certification. They can do things like take the vitals on a patient, do nail trims. These are some of the things that are in here. Anything that's non-invasive, husbandry type stuff. Monitoring anesthesia, but not actually admitted or setting it up, that sort of thing, collecting urine samples, those sorts of things. Now, there is a very different level of skill set for somebody who is registered with the state board. They have a lot more qualifications to do complicated things. They can do things like induce the anesthesia by injection. They can do simple dental extractions, suturing skills, staple removal. I mean, I can go through the list, but it's their cytology, things that you kind of have to know a little bit about. They can administer vaccines under this bill, but they cannot administer rabies vaccines. Why? Because y'all know we had that fight last year, and that wasn't a hill that I was willing to die on for this bill. So there are a lot of things that they can do that they're not currently necessarily being utilized for because it's just not clear and no one really knows, right? So I appreciate all the testimonies today. I want to make sure that everyone does know that every one of those amendments that they suggested, except maybe one, I have adopted and I have already put into the amendments office. So we should all be in very, very good shape on this bill. But if there are questions about specifics, then, please let me know and we'll see if we can work for it further.
Thank you. Just a quick follow-up question. So under supervision doesn't necessarily mean the veterinarian has to be standing right there.
Right. I apologize. I didn't really answer your question. So there's 3 levels of supervision. There is a direct supervision, which means the veterinarian is right here. You might be monitoring the anesthesia, but the veterinary is doing something right there next to you, right? There is an indirect supervision, and this is the one that we're really trying to codify, which means the veterinarian's in the next room doing surgery with somebody else, or is doing something else in another waiting area. And yet you have been instructed by that veterinarian who believes that you have the skills to do these other duties, right? And then there is a third area that we really are not, I'm sorry. It's immediate, direct, and indirect, but we don't really have much under this bill that is indirect other than the things that are non-invasive than a non-registered person could do anyway.
Okay, thank you.
Okay, so I know it's a little complicated.
Thank you.
Great. I do not see any further questions. That concludes the bill hearing on HB 1097.